Okay, here we are, Retinal Consultants Medical Group. Dr. Medina, good to see you again.
It's nice to see you.
Clinical trials, you do a lot of those here, huh?
This is what we do, and this is what we do here. It's all clinical trials. This is our clinical trial department. We're a center of excellence of clinical trials for Retinal Consultants of America. We have about 40 active clinical trials here, so we're treating about 250 patients with novel treatments for retinal disease. That means treatments that were not available before and that we're looking at because they're either better than the ones that we have or they're treatments for previously untreated diseases of the retina.
Who would be somebody that's a perfect person to come in for these clinical trials?
So obviously people need to be motivated to come in. They want to be treated with the latest and greatest, or patients that have previously untreatable disease as well.
Okay. You do a lot of things here too. I know there's a big facility. Can we take a look at a few things and maybe when somebody comes in for one of these clinical trials where they would go?
Absolutely.
Okay, let's go check it out. So this is kind of a lot of different cameras to look at the eye for, of course, all of your clinical trials.
Yeah, this is one of the rooms here in our clinical trial department that has the instrumentation that we use to look at the structure and the function of your retina. So we have cameras that take fancy pictures of the back part of your eye,
right?
Machines that measure the function of little parts of your retina or the macula to see if these medications are working in maintaining or improving the function of your retina. So with this machine, we can take pictures of the retina to see if these new treatments are working. Hopefully they're working and we're able to give patients less injections, do less laser, do less treatments. They're stronger, better than what we currently have.
Unbelievable. You have a lot of IC assistants and people working with you and making things obviously smoother to make sure the outcomes are what we're all looking for, right?
It takes a village.
It takes a village to make this happen.
It takes a village.
Hard
We
workers.
have great people.
Yeah.
Janet is one of you.
Wow. And again, if someone is ready for a clinical trial, they can contact you, or does their doctor contact you? How does that work?
So, your doctor, when you come here, will look at your eye, will determine what's going on, and will offer you either new treatments within the clinical trial area or treatments that are already established and help you choose what's the best choice for you.
All right, so tell us about this one. What is this one here?
So this is a Maya 3 microperimeter. So here we stimulate your macula and we see how it's functioning. So more than looking at just the structure, seeing if it looks sick, we're testing it out to see if it's working well.
So much technology. This is another high-tech camera?
Yeah, this is an Optos.
Okay.
This is a wide field camera. So you don't need to be dilated, and we can look into the eye and get an image of your retina without dilation. So we can see very far out the periphery.
Wow, this is amazing. And this process too, same thing when someone comes in, they can book their own appointment, right, if they need to. Don't need to be referred.
Sure. So yeah, patients can self-refer. Usually they get referred by their primary care doctor or their eye doctor, but they can self-refer. And we're, very proud to serve the Northern California area.
That's fantastic. How long would this process take when you bring a patient in here?
For the picture?
Yeah.
The pictures are quick.
Quick?
Yeah, they're about a minute or two. The appointments are long because usually we bring you in, we check everything, we dilate your pupil, you get imaging and exam as well as usually treatment if you need it that same visit. So an hour to an hour and a half long visits.
All right, well, thanks so much for the tour. That was amazing.
It's my pleasure.
Got pictures of my eyes. I can finally see again now. Yeah, it was not invasive at all. It was great. So easy to make an appointment, no problem. As far as we don't need to go through any doctors, we can call ourselves.
Yeah.
That's good. And insurance as well, right?
Anything we can do to help.
Yep.
You let us know.
We're good to go. Thank you so much.
It's my pleasure.
There you go.
Thank you.
There it is, Retinal Consultants Medical Group. They are at 3 Park Center Drive right there, Suite 100 in Sacramento. Give them a call, go to their webpage, and also check them out on socials.